is Sandra Barrington, Executive Director of Sierra Nevada Memorial Hospital Foundation, and welcome to Doc Talks. This is a series where we bring local physicians to you to learn a little bit about their background, what they've been doing in the community, maybe a little bit about the future of what healthcare looks like for them and their specialty. And today I have a wonderful guest with us today, Dr. Kimberly Bonney, our local audiologist at Gold Country Hearing. Welcome.
Hey, thanks for having me.
Yeah, thanks for being here. Appreciate it. And it's been a while since we've seen each other, so this is exciting.
Very exciting.
Yeah. And share with us a little bit about your educational background and what it takes to become an audiologist.
Yeah, I would love to. So my educational background, I kind of started late figuring out what I wanted to do, wasn't sure what I wanted to do. Many people don't even know what an audiologist is, right? Mm-hmm. And so I started off going back to school after being a hairdresser for 10 years, believe it or not. I knew I wanted to go into healthcare. I really had a passion for healthcare. My whole family's in healthcare in some form or another. And I knew I wanted to help people. I just didn't know exactly how. And so I started off at Sac City College doing just general science prerequisites while I was kind of figuring it out. And it turned out that they had a really great communication disorder program at California State University, Sacramento.
Right.
At the time that I went to school, it was a bachelor's degree and then a master's degree. Communication disorders is the bachelor, and then you specialize in speech pathology or audiology. And I had an aunt, actually, that's a speech pathologist. And so I went and worked with her to see what she did. I thought I loved it. Then I started in the program and I realized I didn't really have a passion for it. But there was a professor there that was so passionate about audiology. It was where I learned about audiology. And I just loved the science behind it, the personal connection behind it, the fact that we could use technology to give instant gratification and success for people with hearing impairment. And so I finished my bachelor's, went on to the master's. Then subsequently, it has transitioned to a doctoring level profession. And so I did go back to school to become a doctor of audiology.
Oh, wow.
And I did that actually finished right in 2010, which is when I started here in Grass Valley.
Yeah. And what made you choose, this rural community? It sounds like you had a connection to Sacramento, so you were close.
I was born and raised in Sacramento. My grandfather, actually on my dad's side, was raised in Grass Valley.
Oh, okay.
He actually went to Grass Valley High School.
Oh my gosh.
His dad was a mining engineer. And so Grass Valley was just really near and dear to my heart. And after I finished school, and I worked as an educational audiologist for many years, and then I decided private practice is really where I wanted to be. I really wanted to make an impact, and I wanted to work with the older adult population as well. And so I actually went to work for a hearing aid manufacturer. And my territory was Northern California, and this was one of the areas I came and called on the audiologist that was here at the time. And I just loved coming here. I loved the community. It just really aligned with how the healthcare in general in this community really aligned with how I wanted to have a private practice and work in healthcare. And so she ended up moving and was selling the practice. And I thought, this is just the perfect place for me. It just seemed really like it was meant to be.
Oh, good. Well, you had that family connection. Yeah, that's wonderful. So what does a typical day look like for an audiologist? Like what types of services are you providing in any given day?
Yeah, so for me, I know we were chatting beforehand. I've expanded to 7 locations in Northern California. So I'm not really working in the clinic on a daily basis doing patient care. But when I did, we actually have 4 providers here in our Grass Valley office. Oh, wow. We have 2 doctors of audiology, a hearing instrument specialist, and then a trainee, and then actually a audiology technician as well. And so on a day-to-day basis, we might see anything from somebody who has sudden hearing loss. Many people don't know, but sudden hearing loss is really an emergent situation. You can have idiopathic sudden sensorineural hearing loss, and if it's not treated quickly, your chances of it coming back are really slim. And so, we might be working in somebody that has sudden hearing loss. We might be doing diagnostic hearing testing for an ENT to help, determine site of lesion for different types of hearing losses. We most often are working with patients that have hearing devices to hear, which is the main thing that as audiologists we do is we're treating hearing loss that isn't medical necessarily. There's no surgical or medical intervention for that, and so then we're treating them with hearing devices. So most of the time we're helping people hear. I mean, when people have hearing devices and something isn't right, they're disconnected from everything, right? And so we need to get them in right away. So there are days where we have 30, 40 people that walk in on a walk-in basis. We really provide same day service for our patients because we want them to hear all the time.
That's amazing.
So we're really troubleshooting hearing devices. We're helping them connect to their phones or different accessories that they use, and just keeping people connected with their families and
the technology has grown so much.
It's crazy.
I know some people who wear the earbuds that connect to their iPhone or their whatever device they have that amplifies, the sound in a room. So, yeah. I mean, there's so much great technology these days. And we actually recently have 2 different categories of hearing devices. There's prescriptive devices, and then there's over-the-counter devices. And those are great. You can they're self-adjusted, but it's a really good entry way to hear without committing to hearing devices if you're not quite ready for that. But the great thing is the hearing devices do the same thing. They connect to phones, and everything. You can turn the volume up, down. You can talk on your phone with it. That's pretty amazing how far the technology has come.
It's really exciting.
So what do you think the future of your specialty looks like in our community?
I mean, I think there, like I said, there's so much more awareness out there right now that people are wanting to get tested and get checked and get a baseline. And I think what I would really want people to know is that hearing loss is so vital to you're at 2.4 times greater risk of falls if you have untreated hearing loss.
I did not know. We run a falls prevention program, so that is really good to hear.
Right. And also, a lot of people don't know that hearing loss is an independent risk factor for dementia, cognitive decline, and social isolation. There's so many things that are really, that I know as a community and a hospital system here in Grass Valley, looking at preventative care and also just healthy aging, right? We don't want to just live longer. We want to live healthier, longer lives, right? And hearing is so vital to that. And so I really just see getting more involved in the community, in the healthcare system, educating people on the importance of early intervention. And we really just have such amazing tools to do that with that it's really exciting. So I see it just getting better and better. There's less stigma. People walk around with devices in their ears now, and so I think it's an exciting time.
Well, thank you for all you do to serve our community.
Thank you.
And thank you for joining us at Doc Talks. You can find us at supportsierranevada.org, at Nevada County Media, and you can check out our Facebook and Instagram pages. Thank you.